Welcome to The Explainer. Today, we're taking on a really complex and critical piece of regulation, and we're going to turn it into a clear, actionable roadmap.
So, if you're in the in vitro diagnostics industry, you're probably feeling it, right? That immense pressure from the new in vitro diagnostic regulation, or IVDR. It's a huge shift in how devices are regulated. But don't worry, we're here to give you a clear map to navigate what is arguably the most critical part: performance evaluation. At its heart, the IVDR just flips the old model completely on its head. We're moving away from the old directive, the IVDD, which was mostly reactive, dealing with problems after they happened. Now we have a proactive, life cycle-focused approach. This isn't about reporting incidents anymore. It's about proving performance continuously, which, as you can imagine, brings a ton of new challenges. All right, so here's our game plan for today. We'll kick things off with a big IVDR challenge itself. Then we'll break down the three essential pillars of performance evaluation. That's scientific validity, and then analytical and clinical performance. After that, we'll look at the living document cycle that ties it all together, and we'll finish up with the real-world hurdles that companies are facing right now. Okay, let's get into it. Okay, the first and probably most important thing is a shift in mindset. You've got to stop thinking of performance evaluation as just another regulatory hurdle to jump over. Instead, you need to see it as your strategic roadmap. It's the documented journey you have to take to prove your device's worth, its safety, and its effectiveness under this whole new law.
The regulation itself, right there in Article 2, gives us the official definition. But let's break that down, because it's so much more than a definition. It's a mandate. You'll see it detailed all through Article 56 and Annex 13. Basically, you are required to assess and analyze a ton of data to prove three things: scientific validity, analytical performance, and clinical performance. And as we're about to see, these three things are the entire foundation of your submission.
This whole process rests on these three fundamental pillars, and you have to think of them as a logical sequence. You can't just pick and choose. First, you have to prove the scientific validity. Is the basic science even sound? Then, you prove your device's analytical performance. Does it actually work reliably in a lab setting? And finally, you prove its clinical performance. Does it really help the patient? Each one builds on the last. You can't skip a step.
So let's start at the beginning with Pillar 1, scientific validity. Before you can prove your specific device works, you have to prove that the underlying science it's based on is valid. This has nothing to do with your product yet. It's all about the established scientific principle. Scientific validity is just the proven link between the thing your device measures, that's the analyte, and the clinical condition it's used for. The classic example is glucose and diabetes. The fact that measuring glucose levels is a valid way to diagnose and monitor diabetes, that's an established scientific fact, and that is scientific validity. So how do you actually prove this? Well, the gold standard, and what regulators absolutely expect to see, is a systematic literature review. This isn't just a quick search online. It means methodically searching and analyzing all the existing research with predefined rules for what you include and exclude. You'll often back this up with things like expert opinions, and crucially, you also have to define the state of the art. What's the current best practice for diagnosing this condition today?
Okay, so you've laid that scientific foundation. Now we can move on to pillars 2 and 3. And from here on out, it's all about proving that your specific device works the way you say it does. This happens in 2 stages: showing its analytical performance in the lab, and then its clinical performance using real patient samples.
And let me tell you, the IVDR's Annex I leaves very little room for interpretation. You need to conduct some really rigorous lab studies to prove a whole list of parameters. Things like, can it find the target and only the target? That's your sensitivity and specificity. Is it consistently accurate and repeatable? That's trueness and precision. You also have to figure out the smallest possible amount it can detect, and even what other things might interfere with the result. It's thorough. Then you get to clinical performance, which is all about proving your device provides clinically useful information. And the amount of evidence you need to show is tied directly to your device's risk class. For a lower risk Class B device, you might get away with using retrospective data. But as you climb up that ladder to Class C, and especially to the highest risk Class D devices, the demand for really substantial, often forward-looking clinical studies goes way up. Now, these pillars aren't just one-time checks you do before you launch, and this is so important. They are part of a continuous, living documentation cycle that lasts for the entire life of your product. This whole cycle revolves around 2 absolutely critical documents. The easiest way to think of it is the plan and the report. First, you have your Performance Evaluation Plan, or PEP.
This is your game plan. You write it before you do any studies, defining exactly what you're going to do and what success will look like. Then, after the studies are all done, you have the Performance Evaluation Report, or PER, and that's the retrospective summary of all your evidence and the results. And here's the key takeaway. It's not a straight line. It's a continuous loop. You plan with the PEP, you execute the studies, you report the results in the PER, but it absolutely does not stop there. Step 4 is to update. You have to continuously collect data from the market through what's called a post-market performance follow-up, or PMPF plan. That real-world data then feeds right back into the beginning, forcing you to keep your evaluation current for the device's entire life cycle. And this just perfectly illustrates the core philosophy of the regulation, which is stated directly in Annex 13. Performance evaluation is not a single event that you finish, file away, and forget about. It is an ongoing commitment to prove your device's safety and performance for its entire lifetime on the market. So, while the framework seems clear on paper, applying it in the real world, well, that presents some pretty big hurdles that manufacturers are struggling with right now. Let's look at what the data from the industry is actually showing us.
This is pretty fascinating. This data from MedTech Europe shows the average time it takes to get a performance study approved in different EU countries. And as you can see, it's a complete patchwork. It's all over the place. This kind of variation creates a hugely unpredictable landscape if you're a manufacturer trying to plan big multi-country studies and product launches.
And it's not just about study approvals. Industry reports show that manufacturers' biggest frustrations with their notified bodies, the auditors who review their files, are all the same themes. Long, unpredictable timelines and inconsistent interpretations of the rules between different notified bodies. This kind of duplication and delay just creates a massive administrative burden. So, this brings us to the ultimate question. And it's not just about how to comply. It's about a shift in mindset. Is your performance evaluation process going to be a painful compliance checkbox you just have to tick? Or can you transform it into a strategic asset that continuously proves your device's value and safety over its entire life cycle? That's really the challenge and the opportunity of the IVDR